Hi, everyone. I'm Dr. Jide, a primary care doctor and clinical governance lead in the NHS. Welcome to Health Conversations with Dr. Jide, where we make healthcare clearer, kinder, and easier to navigate. If you've ever tried to book a GP appointment and thought this is impossible, you're not alone. Today, we'll break down exactly how to get the right GP appointment for your needs and a few insider tips to save time and frustration. The NHS GP appointment system can feel complicated, but it's built on one goal, and that is getting you the right care by the right person at the right time. Appointments are usually offered in three main formats. You have the same day or urgent appointments. These are for problems that need attention now, like chest discomfort, infections, or new symptoms. There are routine appointments for things like medication reviews, ongoing medical condition checkups, or follow ups. And thirdly, you have the telephone or online consultations. These are for quick advice, test results, or if your condition can be safely managed remotely. Most practices now use a triage system, and this means a clinician or care navigator reviews your request and directs you to the most suitable appointment. This is not a barrier, it's actually designed to help you reach the right person faster. Here's how to make the system work for you. Use the online tools first. Most surgeries now use the NHS App, eConsult, or AccuRx for online requests. You can submit your symptoms 24/7 and no need to call at 8 a.m. Be clear and concise. When describing your issue, please mention how long you've had it, how it's affecting your daily life, any red flag symptoms like fever, breathlessness, or bleeding. This helps the triage team prioritize safely and quickly. Use the NHS app. You can view test results, order prescriptions, and sometimes book directly with nurses, pharmacists, or physiotherapists. If it's urgent and you can't get through, call NHS 111. They can book you directly into urgent treatment centers or even into GP slots, depending on your area in the UK. Remember, in modern general practice, it's not always about seeing a doctor first. You might be offered an appointment with a clinical pharmacist for medication issues, nurse practitioner for minor illnesses, a first contact physiotherapist for joint or muscle pain, or a mental health practitioner for well-being support. These are professionals, all part of your GP team, and sometimes they're exactly who you need most. Remember, it's one NHS team, just with more specialists to support you. A few final tips. Register with a GP practice near you early. Don't wait until you feel really poorly. Keep your contact details updated so the surgery can reach you. Use pharmacy wisely. They can handle minor ailments, saving you a trip to the GP. And be kind to practice staff. They're following the process to help you access care safely. I hope this helps you feel more confident booking your next GP appointment. Next week, we'll look at when and how to use the urgent treatment centers versus A&E. Another NHS confusion, right? If you found this useful, please subscribe, like, and share this with friends or family who struggle to book appointments. I'm Dr. Jide, and this has been Health Conversations, helping you make sense of healthcare one conversation at a time. See you in the next episode. Bye.